Have you ever looked in the mirror and noticed a tiny yellow bump on the white of your eye, usually on the side closer to your nose, and thought, wait, what is that? It can look scary, but in many cases it is something common and usually harmless called a pinguecula. A pinguecula is a small, slightly raised, yellowish growth on the conjunctiva, which is the clear skin that covers the white part of your eye. It most often shows up right next to the cornea, but it stays on the white part of the eye and does not grow onto the cornea. Think of it like a little callus on the surface of the eye, formed after years of irritation from the environment, especially sun and dry, dusty air. A lot of people have a pinguecula and do not feel anything at all, and they only notice it because of how it looks. When it does cause symptoms, it is often dryness, burning, or a gritty feeling like there is a grain of sand in the eye. It can also make the eye look red or irritated, especially if the bump gets inflamed, which is sometimes called pingueculitis. If the surface becomes rough, it can disrupt the tear film, meaning your tears do not spread smoothly across the eye, which can make dry eye symptoms feel worse. The biggest driver is long-term exposure to sunlight and ultraviolet light, which is why pingueculae are more common in people who spend a lot of time outdoors. Wind, dust, and sand also matter because they constantly irritate the surface of the eye over time. Age plays a role too, since this is considered a degenerative change of the conjunctiva that becomes more common as people get older. And here is an important point: a pinguecula is different from a pterygium, sometimes called surface eye, because a pterygium can grow onto the cornea and may affect vision, while a pinguecula stays on the conjunctiva. An eye doctor can usually diagnose a pinguecula during a routine eye exam by looking at the front of your eye with a microscope called a slit lamp. They will also make sure it is not something else and check whether it is causing dryness, inflammation, or any effect on your vision. If you have pain, a sudden change in appearance, or your vision seems affected, that is a good reason to get checked sooner rather than later, because other conditions can mimic irritation and redness. Most of the time, treatment is simple and focused on comfort, not removing the bump. Lubricating eye drops, also called artificial tears, can reduce dryness and the scratchy sensation, and gels or ointments can be used for extra lubrication when needed. If inflammation is more intense, an eye doctor may use prescription anti-inflammatory drops, such as short-term steroid drops, to calm things down. Surgery is rarely needed and is usually considered for unusual cases like persistent symptoms or cosmetic concerns, not because the pinguecula is dangerous. Prevention is a big deal because protecting your eyes from UV light, wind, and dust can help keep irritation from getting worse. So think sunglasses and a brimmed hat when you are outside, especially in bright sun. If you found this video helpful, consider subscribing and checking out the next video.